Orthovisc sodium hyaluronic, manufactured by Anika Therapeutics, is a hyaluronic acid-based medical product designed to replace endogenous hyaluronic acid, or HA, in the knee joint. Studies have shown that the synovial fluid in diseased joints contains HA that has a lower molecular weight and lower viscosity than is present in normal joints. Injection of Orthovisc into the knee supplements the synovial fluid to help its ability to lubricate and cushion the joint, thereby reducing the pain and stiffness associated with osteoarthritis. With its high purity, high molecular weight, and high concentration, Orthovisc provides a safe and effective treatment for osteoarthritic patients. Now, let's review the procedure for injecting Orthovisc. As you will see, it is a fairly simple technique.
I use Orthovisc in my patients that have not responded to a non-steroidal anti-inflammatory medication or to modification of their activities. I use it before I use steroid injections in the knee, and I use it usually before I do arthroscopy. Sometimes I'll use it after arthroscopy if a patient hasn't responded to that operative procedure or if I find signs of osteoarthritis at the time of surgery. I also use Orthovisc in patients that have more severe osteoarthritis and have a desire to avoid operative intervention. So patients that want to put off a total knee replacement. Before we go ahead and inject a patient, let's look at some x-rays of typical Orthovisc candidates. This is a set of standing x-rays of the right and left knee of a patient that I consider to be an excellent Orthovisc candidate. When you look at his right knee, he has a well-maintained joint space laterally and medially. You look at his affected left knee, he has a widened lateral joint space and a narrowed medial joint space. If we go ahead and measure these joint spaces, we mark his right and then his left joint space and measure this one to be 6 millimeters and the affected side to be 3.5 millimeters. So that puts him at about a stage 3 grade of osteoarthritis. This is an excellent candidate for Orthovisc. Let's look at another candidate for Orthovisc. Here's a patient with primarily patellofemoral osteoarthritis. So bad on the left knee that it resulted in a total knee replacement. That's the Zimmer Next Gen total knee replacement. Here on the right knee you see a narrowed patellofemoral joint space, but it's not completely obliterated yet. This is a good candidate for Orthovisc. And now finally, a patient with severe osteoarthritis of the medial compartment of this left knee. You note the increasing bow-legged deformity. This patient's still a good candidate for Orthovisc in that it may delay his surgery, or it may allow him to continue functioning if he prefers to avoid surgery altogether. But the results may not be as predictable as they are in the first patient, which I consider to be an excellent candidate with the grade 2 or 3 osteoarthritis. Now let's go and inject a patient. It's important to have the patient in a relaxed position. I like to have the patient supine. I find they're most relaxed in this position. Some physicians will like to do the injection with the patient's leg over the edge of the table. I find the patients to be too tense for that particular type of position. So I like them in a supine position. I like them relaxed. I don't like their hands behind their head. I like their hands on their tummy. And I generally like their toes to be pointing towards the ceiling and the leg lying flat. Now, the next thing you're going to do is to assess the knee for an effusion. So you're going to palpate the knee and see if there's any significant effusion present. Now, if there is a significant effusion, you've got two choices. You can either aspirate the effusion prior to the injection, or you can hold off on the injection for that day and come back at a later time when the knee is less inflamed. After you've established that there's no significant effusion, you want to palpate the landmarks of the patella: superior pole, inferior pole, medial and lateral borders.
With an appreciation for the radiographic and anatomic variation of each patient's knee, you can prepare to enter the intra-articular space through a lateral, medial, or alternative approach. Your own experience and clinical judgment should serve as a guide for each series of injections.
I like to inject along the medial border of the patella. Now, to accentuate the area that I like to inject in, I gently medially displace the patella, and that creates a little sulcus here. It brings up the medial border of the patella and creates a nice potential space to inject. I like to inject about midway from the superior to the inferior pole of the patella, and in a plane that is perpendicular to the skin in both directions. Once you've established the ideal location for the injection, you can mark that skin position with a pen to make that injection easier. So again, that's along the medial border of the patella, about midway between the inferior and superior poles, and in that little sulcus that we create by medially displacing the patella. The next step is going to be sterilely prepping the area. It's important to use good aseptic technique and to use the appropriate antiseptic solution. You want to prep from about 4 inches above that location to about 4 inches below. And the first thing I'm going to do is I've opened up a sterile prep tray here, and I'm going to put on to the tray my Orthovisc syringe. Now you don't really need an assistant for this. You can just drop the syringe onto the tray and then don a sterile pair of gloves. Now, some physicians will choose to inject the site of injection with a local anesthetic prior to adding the Orthovisc. I find that that just produces 2 injections and is unnecessary. Most patients find that 1 injection alone is as good as the 2 with the anesthetic. So once we've donned gloves, we're going to prep the site. And I'm using providine here. It's a 1% providine solution. And we're going to start at the location, and we're going to prep 4 inches above and 4 inches below. Because this is an intra-articular injection, I like to be extra careful with it. And so we'll cover that area one more time. Again, 4 inches above, 4 inches below. Once you've prepped it, you can add a drape. And that drape just helps me to have the location of the site. Now we'll add the needle to the syringe. There's a small plastic cap that is removed first, and we'll take the lock off the syringe. We're ready to do our injection. Again, medially displace the patella. Then I like to hold the syringe like this. It allows me to give enough force to inject it. This is a 22 gauge needle. The needle is put in perpendicular to the skin and in about 1 inch and injected. Now, after I've injected the patients, I usually tell them what they can and cannot do. I like them to avoid excessive activity for the 48 hours after the injection, but they can continue to carry on in their activities of normal living. I like them to not go in swimming for the first 24 hours, as this puncture is a portal of entry for bacteria into their knee. I want them to stay out of swimming pools, which are notoriously full of bacteria. I tell them after their 3rd injection that they have approximately 4 or 5 weeks before they're going to notice the maximum benefit from Orthovisc, and that benefit will usually last about 6 months. Now, I ask them to call me or come back and see me after that period of time.
Viscosupplementation is a proven method for treating osteoarthritis of the knee. As you have seen, the Orthovisc injection technique is fast, simple, and straightforward, making viscosupplementation an efficient and effective in-office procedure.